Welcome everyone to Montgomery County's transportation options for older adults and adults with disabilities in Montgomery County. I am Lily Fisher and I am going to be providing assistance to our amazing team that have come together to provide this program.
My name is Shawn Brennan. I work with the Department of Health and Human Services. My area of focus is transportation and mobility. And I'm so pleased to be working with my colleagues from Jewish Council for the Aging and the Montgomery County Department of Transportation. And they will be introducing themselves prior to their segment of the presentation. So I'd just like to start by focusing a little bit on our age-friendly community. We're really working hard to look at all the aspects of Montgomery County that make it a lovely place to be throughout life. And making sure that there are transportation options is one part of that. Our age-friendly Montgomery plan includes a number of goals related to transportation, things like improving the accessibility of transportation, making transportation affordable. And one of the other goals is making sure that people are aware of the transportation options that are available to them. So that's just a little bit of a background. And in the way of background, before we dive into the specific programs and services that are available, we're going to talk about strategies to protect yourself while traveling in light of the pandemic. We're going to talk about discounted taxi programs. We're going to talk a lot about our local bus service, Ride On, and some very exciting new services that the Ride On system is introducing. We're going to talk about a wonderful information and referral service called Connect a Ride. We're going to talk about some of the volunteer transportation programs that are available in the county, and we're going to talk about paratransit, which here in Montgomery County, we are able to use something called Metro Access. So now we can talk quickly about, when you're traveling, how to protect yourself. And the Centers for Disease Control has provided some guidelines, and I put a link there, and I will also put it in the chat so you can easily link to it later, or you can Google protecting yourself while traveling, and you will probably find this information from the Centers for Disease Control. So I'm just giving you a Reader's Digest version. And so the first thing to keep in mind that if you're sick or if you've had close contact, that is being within 6 feet of someone with COVID-19 or suspected of having COVID-19 for 15 minutes or more, to please stay home unless you're seeking medical care. That's an important lesson right now as the numbers are worsening. Just moving on to the next slide, I wanted to encourage you to think about the various aspects of safety. And this is in general, but in particular when you're traveling. So of course, good hand hygiene is very important, and respiratory etiquette. And what we mean by that, of course, is washing hands for at least 20 seconds, soap and water very carefully, perhaps singing happy birthday to yourself twice, or using hand sanitizer that has at least 60% alcohol. So you want to make sure your hands are clean before you leave the home, and then whenever you've arrived at your location. We always need to avoid touching our eyes, nose, and mouth. It's a very easy thing to do. We do it unconsciously, but we have to try not to do that. Use hand sanitizer if we do. If you have to cough, you please use a tissue or the inside of your elbow to contain the spray. Throw used tissues in the trash and wash your hands immediately after that kind of activity. When we're out and about, we're touching things that other people have touched. So when you're traveling, please try to avoid, to the extent that you can, touching touch screens, ticket machines, turnstiles, handrails, restroom surfaces, elevator buttons, benches, doorknobs, door handles. Try to pay in a touchless way where possible with credit cards or through apps. And when you find that you have to touch these things because there's just no avoiding it, then hopefully you've carried with you some hand sanitizer that again has at least 60% alcohol, and you can clean your hands. So of course, we all know we're supposed to wear a mask and keep a distance from other people. And in the travel world, that's can be difficult, but standing at a bus stop, please stay 6 feet away from another person. That's approximately 2 arms length. Certainly sit as far away from other people on buses and trains as you can. And always, please wear a mask. If you have any control, if you find that there are other people who are not wearing masks and you can delay your trip, you might want to do that. And then when you're using a taxi or perhaps Uber and Lyft, that's what we refer to as rideshare vehicles, or you're carpooling. Yeah, don't ride if everyone in the vehicle is not wearing a mask. Ideally, there's only maybe one other person in the vehicle. Please don't be tempted by offers of free water bottles or anything that you have to touch that perhaps somebody else has touched. Again, use a touchless payment. And if you can lower the windows yourself, great, or ask the driver to open the windows. This is to enable ventilation. That's going to help minimize your risk of any contamination. So thank you for keeping those safety tips in mind. And I'm going to hand off to Sam Aji from the Montgomery County Department of Transportation.
Thanks, Sean. Thank you, everyone, for joining us today. We are happy to have all of you on. Since the pandemic, we've been unable to do what we normally do, which is be out there in the community and raising awareness about all our transportation programs that are available for older adults and people with disabilities. So today, hopefully, at the end of the presentation, you would have some more information than you previously had and something that can guide you as you make your decisions. We are not trying to share information about these programs to prompt you to leave your homes and go start using the service. We just want to make sure you have them available when you choose to, when you're comfortable traveling, when you're taking essential trips, that you know of all of these options. So today, I'll cover a few of the programs listed here. I will start with our vision and mission statement. I'll talk about on-demand taxi service, which is call and ride. I'll talk about same-day access, which is our alternative to Metro Access. I'll talk about the medical assistance transportation program. I'll go into some details about our ride-on operations, what we've done since COVID to keep our customers and employees healthy and safe. I'll talk about some new services, the Flash, the relaunch of our Flex, and talk about an exciting grant that we just received from the federal government. So the Department of Transportation, our vision is to have a seamless transportation system for people of all ages, incomes, and ability that supports a vibrant and sustainable community. So basically, the services that we put out there, we want to make sure that this diverse community that we live in, people of all ages, incomes, and abilities have an opportunity to access these services. So these are all considered when we put these programs and services together. And our mission, obviously, is to move people and connect places with the best transportation choices and services that we can. So the first program I'd want to talk about is a call and ride. It's an on-demand transportation taxi service. It's for our residents who are 65 years and older, and for individuals with disabilities who are adults, 18 years and older. This program currently serves about 5,600 residents. Before COVID, we were doing about 11,500 trips a month using taxi cab companies in the county. Obviously, with COVID, the trip totals have gone down, and the last 3 months, we're averaging about 8,000 trips for call and ride. And this is participants receive discounts to use the taxi service. It's on a sliding fee scale, and this is based on your household income. Some people receive 50%, some people receive up to 91% discount for their taxi rides. The county provides a maximum of $120 value on each participant's county issued swipe card. So like a credit card, but it's closed loop, works in all the cab companies, and you can use it to take your trips. What's been going on since COVID? We have decided, since we knew that the stay-at-home order would impact a lot of our program participants who are older adults. 70% of the participants are older adults in this program. So we decided to add another component to the program, which we call essential delivery services. And what that means is encouraging our participants to stay at home. We worked with the cab companies to make sure that they are able to pick up food for our participants from the grocery stores, restaurants, or food banks after those orders are placed by our participants. And they do a touchless delivery to the client's door, and then the cab company is reimbursed by the county with value from the client's card. So that's one thing we've implemented since March. It's been well received. A lot of participants are taking advantage of it while they stay at home. One of the other things we did is also to suspend recertification. So any of the participants in the program whose participation period was due to expire, we extended those participation periods to make sure that they're still able to use their card without any issues if they're unable to recertify. So that's a couple of things. Now, we worked with the vendors, these are the taxi cab companies, to ensure that they prioritize the health and safety of participants as well as their employees. So their vehicles are sanitized daily. They've installed partitions between where the driver sits and where the passengers will sit. And they have a mask requirement for both the drivers and all the riders in the cabs. And I just want to add quickly, we also received a federal grant for the Call and Ride program in 2019. This has helped us further reduce the monthly co-payment, which participants usually will pay each month to receive value on their cards. And the next one I want to touch on will be same-day access service. So this is an additional option for Montgomery County Metro Access participants. So as we know, Metro Access, you have to schedule the trips at least 24 hours in advance, but the county felt we, obviously would want people to be able to get up and go if they need to travel, whether it's to doctor's appointment, to shopping, anywhere they want to go without having to schedule 24 hours in advance. So over the years, this program was put in place for Metro Access participants. It provides 50% subsidy for taxi trips. You can receive up to $60 worth of taxi rides per month with this program. This was before the Abilities Ride program, and it kind of worked just like the Abilities Ride program, which we know is currently suspended. So this is one that we encourage any Metro Access recipient in the county who is not currently a same-day access participant to please reach out to us, and we will have information on all the phone numbers as we go on, so that people can reach out to us. So as it stands now, because Abilities Ride is suspended, Metro Access participants will have to schedule trips 24 hours in advance, but same-day access gives you the option of being able to get same-day taxi service. So highly encourage Metro Access recipients to consider this option. There is no income requirement to participate in this program. You just have to have a valid Metro Access card, and you are within the certification period for the program. And just similar to Call and Ride, we did add the essential delivery service for same-day access as well. So same-day access participants can get food delivered from grocery store, from food banks, from restaurants to them. We also suspended our recertification period here. And same as in Colin Ride, there are health and safety measures implemented by service providers, cleaning of the sanitizing of the vehicles, the partitions installed, face mask requirements, and so on, just to keep our customers and employees safe. And quickly wanted to touch on the Medical Assistance Transportation Program. This is a state-funded program under the Maryland Medicaid Transportation Program system. It's available to all Montgomery County residents who are medical assistance recipients. And this program provides free transportation to medical appointments for Medicaid recipients who either don't have a means to get to their medical appointments or are unable to use those means because of some limitations in their fiscal ability. So this is one that we also encourage people to look into if you're a medical assistance recipient. The service is free to you. We transport people by taxi cabs. We have wheelchair van vendors. We have non-emergency ambulance vendors, and we actually have aero transport vendors as well. And similar to all the other call and ride and same-day access, we prioritize during this pandemic the health and safety of our participants and employees, as well as the service providers. So they are aware and they continue to implement routinely the sanitizing of all vehicles, face mask requirements, partitions in the vehicles, and adhering to all the social distancing measures that CDC has asked us to implement. And then I just wanted to move on to ride-on operations during this COVID-19. Ride-on, obviously, the Montgomery County Transit System, over 79 routes, actually now grown up to 82 routes, provide service throughout the county, some areas more so than the other. And during this pandemic, we've had to implement processes and systems to ensure the safety of our customers and employees. That continues to be a top priority on a day-to-day basis. So frequent cleaning of all buses. This is done twice a day, at midday and at night. We use Micronex detergent, which is a multi-purpose hospital-grade germicidal detergent. The ventilation systems are cleaned and aired out. We require face coverings. And for those that don't have face coverings, we actually provide those on all ride-on buses. So we have buckets hanging. You can reach in and grab face mask if you don't have any. We were one of the first to implement suspension of fare collection and rear door boarding for all, except for people in wheelchairs or use mobility devices or have strollers with babies in them or generally need the ramp or bus kneeled. Those are the people who can use the front doors of the buses. And then social distancing on the buses, we've implemented capacity limits on all the buses. The 30-foot buses have a limit of 15 passengers. The 40-foot buses, a limit of 20 passengers. This is slightly below half of what the capacity would normally be before COVID. We are currently hoping that by later on this year, early next year, the partitions will be installed on all the ride-on buses. This is the one that will keep the area where the driver or operator sits protected. And at that point, we will revisit a few of these processes that we've implemented and make necessary changes. And this is just trying to give you a slight overview on the ride-on service since the pandemic. what you see is since the pandemic, we've had to adjust the service levels 8 times since March. And just to give you an idea, in a normal year before the pandemic, we only have 3 scheduled changes in a year. But since March, we've had 8. The next one is going to be in January, and that will be the 9th one within a 9-month period. In March, obviously, through March 18th, our service levels were 100% where they usually are, all 79 routes operational. Between March 28th, after about March 28th, we reduced to 50% of our normal level. And the target was, what we called an essential service. We focused on transporting people to hospitals, to grocery stores, food banks, and those are the way those routes were adjusted. So we dropped from 79 routes to 36 routes in April, and the service level dropped to about 32%. In May, it remained about the same, slightly dropped to 30%. In June, as reopening started slightly, we expanded the service in order to also accommodate the social distancing measures that we had in place. We increased to about 53 routes and 44% of the service level, slightly higher in July. And August, we brought back all 79 routes at 72% level, focus on those high ridership routes to ensure that social distancing measures are in place. And the last service change was September 27th, where we increased the levels to about 80% of the service levels, also keeping in mind social distancing and ensuring that we maintain the capacity limit on the buses. The next service change is planned for January 2021. So during this time, we've kind of stepped away from traditional means of sharing information to our customers and potential customers and county residents about services and programs. We could not distribute paper schedules. We could not distribute brochures that are in paper. So we kind of pivoted to electronic means of getting information out to residents and clients and people who choose to use our service or need to know about the service, so that whenever they choose to, they'll have the information. So listed are some of the ways we've been able to. Website has received more visits than ever. We tap into Nextdoor. We have a direct newsletter, electronic gov delivery. Social media platforms has been one of the best ways to get information out and get information out immediately. We have text alerts, partnership with the Regional Services Center, who help us distribute information to residents within their areas of service. And we've also embarked on direct mail campaigns targeting specific audiences based on the program that we're promoting. During this period, also safety has been a top priority. We worked on developing a COVID safety brochure translated in 7 different languages. This is just kind of giving you an idea of what we've done to ensure the safety of our clients when they ride or when they choose to ride the service, and also to make you aware of our expectation of the customer when you get on the bus. You have to wear your face mask, you have to maintain social distancing, you have to board using the rear door. Services are free, you don't have to pay. But also to provide this information and make everyone aware of what we're doing. And this is just some of the information we have out there, making you aware, we're focused on your safety 100%. Frequent cleaning of the buses, social distancing. We've added additional buses to those high ridership routes to ensure that at any point when those buses start getting to capacity, the operator that's operating the bus will inform our central communication And those buses that are placed strategically throughout the county will then pick up the route because the bus that's operating is close to capacity or is at capacity. So that's been one of the things that we've done to ensure that we maintain social distancing. Some things, we've had some good news, some new service added. Flash, which is our bus rapid transit. This started on October 14th. Planning for this has been ongoing for years. This is a limited stop service in the US 29 corridor. Service goes from the Silver Spring Transit Center up to Briggs Cheney and Burtonsville. We have two different routes, the blue and the orange routes that you can ride. These are fast moving service because people don't have to, there's 3 doors you can board from. These are 16 60-foot articulated buses that we purchased for this service. And it's level boarding. When we resume collection of fares, off-board fare collection is what we have. So if you can think of Metro Rail, where you have to pay before you even get to where you board the metro, that's what this will be. There are ticket vending machines at each and every one of the stations. You can pay by cash, credit card, use your smart trip card, and just board as the bus comes. And this gives the bus the ability to operate as quickly as it can. During peak periods, the buses arrive every 7.5 minutes. Off-peak hours, they're arriving every 15 minutes. Service is from 5:30 a.m. till midnight, 7 days a week. And this started on October 14. The feedback has been really great about the service. We are taking some recommendations through this first month of the service and working towards ways to continue to improve and make it a ride that our residents will enjoy to take them from point A to point B. Now, one of our flex micro transits is the on-demand transit that we started a year ago, slightly over a year ago. And this is a NACO award winner for 2020 for innovative transit service. This was suspended because of the pandemic, but we are resuming service in December 2020. I think it's December 7th, 2020. We're resuming service. Flex serves 2 zones, Monday through Friday. It serves the Glenmont-Wheaton zone. These are defined areas from 6 a.m. to 9 a.m. and from 3:30 to 7 p.m. So just peak hours for Glenmont-Wheaton. The Rockville area is another zone, which it serves from 9 a.m. to 3:30. 2 ways you can access this service. You can download the Flex app and you can schedule your trip on your app, just like you would Uber, Lyft, and things like that. As we resume service, we have added a new call center where people who choose to call to schedule their trips can call the call center, provide your pickup and drop off location, and you will be picked up. Now, this service is corner to corner, but if you have a disability, it's actually basically curb to curb for you if you have a disability. So average wait time is 8.5 minutes. We are planning to add a 3rd zone around the 29 corridor, middle of 2021. So, and finally, just wanted to touch on something we received prior to the pandemic, and we will continue to work on this so that as we develop plans for post-pandemic or the new normal, travel training has been one thing that we've been conducting over the years. And this is basically to teach older adults and individuals with disabilities how to navigate the public transportation system, whether it's how to use smart trip cards, how to read the bus schedules, the bus routes, metro schedules, metro routes, when the bus arrives, when the bus leaves, when the metro rail arrives, when it leaves. And we were able to apply and receive a federal grant. And with this grant, we are able to purchase and retrofit a bus. And this bus will be used specifically for travel training. We wanted to use this to enhance the travel training program. We want to expand the geographical service area for the travel training. We want to do more travel trainings. We want to increase the frequency of the travel training workshops. We would like to incorporate different things like Vision Zero, pedestrian safety, and general awareness of how to travel around in the county. So we're really excited about this, and we will continue to update residents as we implement the plans in place to get this rolling during these times. So next will be our partners from Connect the Ride program, which is a partnership the county has with Jewish Council of Aging to provide information, referral service, travel training, and many, many more things. Harriet Block will walk us through the next slides about this. Thank you, everyone.
So we're going to go over a great number of programs this afternoon. Everything can be received after the presentation. You can get contact information later. So if you see and hear programs that you're interested in, certainly you can take note, but know that you don't have to sit and take notes. You can also, at the end of the program, we'll have information on contact information for Connect a Ride, which is the Center for Information Services for transportation options in the county for seniors age 50 and older and adults with disabilities. So we are going to start with, you can see the list here is Connect a Ride. We'll talk about that, volunteer transportation. And as I'm saying volunteer transportation and other rides, remember that during COVID-19, there are many drivers, both paid and volunteer, who have chosen not to drive. So planning in advance when you need a ride is really important so that you can give the driving organizations enough time to match your needs with an available driver. We'll go on and talk about private driving companies that charge a fee for service. Escorted transportation is a program that's operated by JCA, funded by the county. We have 5 taxi cab companies we'll mention. The Metro Access Program, I will go into detail in. I'll mention Abilities rides, the Senior Center Shuttle, Ride Smart Travel Training. So what is Connect a Ride? Let me start by saying that Connect a Ride helps seniors find transportation solutions. Again, the most important thing is knowing where to access information, and that's the first step to getting the rides you need when you want them. So Connect a Ride would be that one-stop shop. If you don't know where else to go and you don't remember anything else today, we hope you remember the name Connect a Ride, the phone number you can write down if you like. Again, we can get this to you afterwards. But Connect a Ride is at 301-738-3252 or by email. And our mobility specialist who's on duty that day will respond to your emails and phone calls. So we're a free service. And again, we're funded by Montgomery County government, the Department of Transportation, and it's operated by JCA. We provide information referrals for transportation options that are appropriate for seniors and adults with disabilities. And it's for Montgomery County residents primarily, where we will link seniors, their caregivers, or professionals to ride options that are appropriate for the individual that's contacting Connect a Ride or on behalf of a senior or an adult with a disability. Connect a Ride is a unique service in that our mobility specialists are all trained and certified, and they provide you with personal assistance. Again, what one person may get as a referral or more than one referral will not necessarily be the same referrals that are given to the next caller. The information referrals are based on your individual needs. You can get assistance with completing Metro Access and call-and ride applications. If you need an application, a paper application sent to you by mail, we can do that. If you need assistance in filling it out, if you're unable to write or you're vision impaired and you need some assistance, our mobility specialist can stay with you on the phone and take information and work through the process or the form with you and then mail it to you for your signature. We also have assistance in various languages other than English via an interpreter service, so you can get translation if needed. One of the really unique things about our service is when we refer to private driving companies, which are also known as fee-for-service companies, the referrals that we give are only to those companies that carry commercial liability insurance and licensed by either the Public Service Commission and or the Washington Metropolitan Area Transit Commission. We do this to protect the riders. If I were a driver and driving a customer that's paying me with my own my own insurance, which is personal insurance, and I got into an accident, the rider would not be covered under my personal liability insurance because I would be running a business and using my personal insurance. So it's important to us to make sure that the riders are covered in the event of an accident. Also, if they're licensed by the Public Service Commission and the WMATC, we call it for short, the Washington Metropolitan Area Transit Commission, we know that their criminal background checks are being run. We know that their vehicles on an annual basis are being inspected. We know that they have a clean MVA record, and we also know that these companies are carrying the appropriate amount of commercial liability insurance based on the type of business they are running. So there are other services out there that are not part of the Public Service Commission or WMATC or do not carry commercial liability insurance. Their fees may be a little less, but their insurance may not cover a paying passenger, and we don't have any way to know that they're getting their vehicle inspected or that they have a clean criminal background. So in order to make certain that is why we only refer to companies with those licenses and the commercial liability insurance. This program, Connect a Ride, is administered or managed by JCA, which is the Jewish Council for the Aging. And it is funded by the Montgomery County Department of Transportation, and Connect a Ride staff work very closely with all the departments in the county to get transportation options for seniors and adults with disabilities. Next, I'm going to talk about volunteer transportation. We're lucky to have several different organizations in the county. One of them is called the Senior Connection. Now, again, this is one of the organizations that has changed their operation a little bit during COVID-19. They have volunteer drivers that are only driving during weekdays for medical appointments. And on Saturday only, they will have drivers do grocery delivery, but they are not taking passengers to the grocery store. They're only delivering groceries that have been ordered and paid for prior to the pickup of the groceries. They'll then drop those groceries off at your door, and you'll be contacted to let you know that you can go outside or to your door and pick up the groceries, so you don't have any contact with the driver. Under normal circumstances, a volunteer driver would pick you up for grocery delivery and take you to the store, or you could have a volunteer pick up the groceries for you and bring it home from a list that you've prepared, and they would then return your receipt and change. That is called the Shoppers Program. Now, for medical appointments, you would get 3 escorted round trip rides per month. That would be for people age 60 and over. Now, there is an application process, and the volunteer drivers do not take people who need wheelchairs. Many of the volunteers, not all, but many, are older adults themselves, and picking up a heavy wheelchair would be difficult for some people. They can accommodate folks who use walkers or canes, and they're happy to do so. Other associations or organizations that Connect a Ride works with, and when we're trying to find volunteer transportation, we try to think outside the box. And disease associations are some of those organizations that can provide some volunteer transportation for a person who has a diagnosis. So for an example, the American Cancer Society, we know, has a small volunteer corps. And occasionally, prior to COVID-19, their volunteer corps was in operation. At this point, I don't think they have many volunteers driving. But again, if someone called Connect a Ride, we could then, the mobility specialist could then check on the level of volunteers and get back to the caller with that information. There are also help groups that operate throughout the county. And just to name a few, there's Bethesda Help, which during COVID-19 has their volunteer service temporarily suspended. Damascus Help, Gaithersburg Help, and WAMCO Help, which is Western Upper Montgomery County. These help groups offer volunteer drivers, and in some instances, if there's not a volunteer driver available, they may have grant funding to pay for taxi rides. Now, I know that's the case in Gaithersburg, for Gaithersburg Help. Not all of the help groups have that, but the taxi rides, paid taxi rides would be offered for residents with low income only. So these are groups that offer volunteer drivers in addition to some other volunteer services. And then we have villages. For those of you who are not familiar with villages that have volunteer drivers, they are grassroots organizations. They have started from a group of neighbors in a neighborhood that want to help other neighbors who are no longer driving. They're a nonprofit. They form a nonprofit organization. There are about 27 of them in communities throughout the county. Each neighborhood village serves residents that live in that specific neighborhood or a zip code, or sometimes multiple zip codes. So for example, Olney Home for Life is in the Olney area, but it also serves 2 or 3 other zip codes in that neighborhood, in that area. They have most of the villages operate a volunteer driving service, and they have neighbors that will pick up neighbors. You may not know someone that's going to pick you up that lives in your zip code, but that's a great way to meet people and make new friends. They'll drive you to medical appointments, hair appointments, religious services, and other things that aren't listed here that you may need. Some of the villages have free membership, some charge membership fees. The services that each village offers is dependent on what each neighborhood needs, and each village makes their own guidelines for their neighbors. So I'm going to go on to fee-for-service companies, and I know I'm going fast. We'll have time to get questions answered at the end. Fee-for-service companies or private driving companies. This could be a one-person operation, what we sometimes call a mom and pop driving company, or it could have many, many drivers and many vehicles. So these private driving companies provide highly personalized service based on the individual's need. It could be escorted. Somebody might need an escort to stay and wait with them, or assisted. Maybe you need some light assistance getting in and out of a vehicle, or just a drop-off pickup. They may help you with groceries or pick up prescriptions with or without you. They may be outpatient surgery where you need someone to get you there and then come back and pick you up afterwards, and escort you into your home safely if you've had anesthesia. There are services that provide carry downstairs and upstairs. If you have a wheelchair, you're in a wheelchair and the elevator in your building's broken and you need to get to an appointment. There are services that then you can get this information again through Connect a Ride. Medical transportation, stretcher service. Again, someone might hurt their back. They're stuck in bed. They can't get downstairs to even get into a vehicle. So there are companies that provide stretcher service, and they are wheelchair accessible companies. These come at a cost. The rates start at about $40 an hour. Years ago when I started working in JCA in transportation, the prices were more like $15 and $20 and $25 an hour, but over the years they've gone up, and the minimum now is about $40 an hour. You can check, and you would need to check with each company that we would give you a referral on. You would need to check what the extra costs are, because you want to be an informed consumer. You want to find out, is there an extra cost for an escort? How about mileage? Who pays mileage fees? Is that part of that $40 or is that extra? Tolls, waiting fee. You want to know what your fees will be, but with a phone call to the company, they can give you that information. And some companies, and many of these private driving companies, have a minimum number of hours. Sometimes it's 2 hours, 3 or 4 hours. Again, Connect a Ride refers to these companies. There are many of them in existence, but we only refer to those carrying the commercial liability insurance and those that are licensed by either the Public Service Commission or the Washington Metropolitan Area Transit Commission for the safety of the riders. Okay. JCA operates a program, manages this program for, it's called the Escorted Transportation Program. And this is another program that is funded by Montgomery County's Department of Health and Human Services. It is a door-through-door assistance with an escort that stays and waits with the rider. And those are two conditions that are necessary in order to be able to use this service. Eligibility is you must have a household income not to exceed $40,000 a year, be age 50 or older, and a county resident. Now, occasionally some exceptions may be made, but those are the standard. You would need to provide proof of income. Also, you'll need documentation from a medical professional. There is a quick turnaround time on the application process, and you would be working directly with the program manager at JCA. There's a sliding scale fee, which the range is $7 to $25 for a round trip ride. And the driving companies that are used for this are private driving companies. And just a couple of slides ago, we saw that fee for service private driving companies, the fees for an hourly fee is $40, starts about $40. So you can see that this is a great reduction that we're able to offer for people with an income that does not exceed $40,000 a year. These are round trip rides that are offered for up to 3 hours, and there are 3 round trip rides per month that are offered. If you see that your ride is going to exceed 3 hours, you will need to speak with the Escorted manager. And that may not be an option for you at that time to use that program. Next, we're going to just look at the taxi cab companies. We're really lucky in this county to have 5 taxi cab companies. The newest among these companies is Anytime Taxi. All of the companies have some wheelchair accessible vehicles, and they will, as the years go on, be getting more as it's mandated by the county. All of the taxi cab companies are overseen by Montgomery County's Taxi Cab Commission. And so they have guidelines and regulations that they have to adhere to, and they're overseen again by the county. So as well, and including the rates are part of what's mandated by the county. So you can not be too worried about being overcharged or taken on a long road trip, because they are monitored by the county. Regency Cab is the one taxi cab company to date who has had a free senior ride program. This has been in existence for several years. It is quite a successful program. They give away approximately 100 free rides per month to seniors who are 70 years old or older. You would have to present or verify your age, so you would have to show them that when getting into the vehicle, or when you call, you would have to verify your age. You can get rides up to 10 miles each way from your home and back. There's 1 ride trip per week that can be scheduled for each person. You need to be one of the first 3 callers of the day requesting the free senior ride program in order to get a next day ride. You need to call by 7 a.m. the day before the ride is needed. And if you call later than 7 a.m. and there's a ride available still, you would be able to get that slot. But very shortly after 7 a.m., those 3 rides are scheduled and booked. If you're calling for a ride on Monday, you need to call on Friday. Okay, Metro Access. This is an important program, and it's a shared ride, door-to-door complimentary paratransit service for individuals who are unable to use accessible fixed route public transit, that meaning Metro bus, Metro rail, or even in our county, ride-on bus, due to a disability. Important words here are shared ride. Now, during COVID-19, Metro Access is only taking and only allowing 1 passenger per vehicle, along with the driver, of course, in the vehicle. And so it is not a shared ride during COVID-19. But in times prior to COVID and when we are safe again to do so, the rides with Metro Access will go back to being shared rides. In order to use Metro Access, you need to live within 3/4 of a mile from this area that is serviced by Metro bus or Metro rail. So a bus stop needs to be within 3/4 of a mile of your home. Cost for the one-way ride is $3 to $6.50. That's dependent on the number of the distance of your trip from your home. There is an application process that includes completed application forms and an assessment. It's a 2-part application. Part A, you would fill out, the rider would fill out. Part B must be filled out by your healthcare provider. When you get your Part B form back from your healthcare provider, you would then contact Metro Access by phone or email and let them know that your form is complete. Now, during COVID-19, you may also be mailing in your form. Connect-A-Ride has those application forms. We can mail them to you. They come with directions, contact phone numbers, information that you would need. And then you would always, if you have questions or need to be walked through the process, you could always call Connect-A-Ride by our number. It's always included. And they could walk you through the process step by step and explain it to you and walk you through the forms if needed. Metro Access also the second part of the application process is a functional assessment. During COVID-19, this functional assessment, which is usually an in-person interview, has been suspended. Only during COVID-19. When it's safe again, they'll have these assessments in person. The assessments are when a Metro Access vehicle will come to your home and take you to the Metro Access office, which is in Washington, D.C., and they'll take you back home. And that will be at no cost to the rider or the applicant. You'll be meeting with a Metro Access staff person who will then interview you and determine whether or not you are eligible for full eligibility or conditional eligibility. Right now, eligibility assessments are being conducted by phone, and we understand that Metro Access is contacting people and getting back to people in a very timely manner to be able to help you get onto the program as quickly as possible. There are 2 types of eligibility. Right now, everybody is getting full eligibility where you can always ride in a Metro Access vehicle if you need it. After COVID-19, it will be either conditional eligibility or full eligibility. If you are fully eligible, that means you must use Metro Access, that you cannot safely use the bus or the Metro. But there are some folks who are conditionally eligible, and sometimes they might want to or feel healthy enough and well enough to be able to use a bus, the Metro or ride-on bus or a Metro rail, and they're conditionally eligible and able to do that. So that will be determined later when it's safe again to have in-person interviews. When you're filling out your Metro Access application, If you need someone to assist you and be with you, and you have a personal care attendant or an assistant or a home health aide that stays with you, or a family member that you would go with when you go to appointments, you want to register for that person as your personal care attendant on your application. Metro Access Metro Access serves the same region that Metro Rail and Metro Bus serve, and that is throughout Montgomery County and Prince George's counties in Maryland, Northern Virginia, and the District of Columbia. Metro Access is a next day service. You schedule trips 1 to 7 days in advance. You can do that 7 days a week by phone or online on the Metro website. There is no same-day service directly through Metro Access. Again, Sam mentioned same-day access that the county offers, and I will be briefly touching on Abilities Ride in another slide. That is same-day service that is suspended right now. But you can see there are several numbers that you can call for questions and through Metro Access. Again, if you're not taking notes on these, or you don't get this after the printout afterwards, you certainly can call Connect a Ride and we can give you the same information. Metro Access customers, it is temporarily suspended. It is a newer program. It's been in existence for about 1.5 years or 2 years prior to COVID-19. It's same-day taxi rides. The trips must start and end in Montgomery County. There's a $5 flat fare for up to 9 miles, $6 up to 10 miles for a 10-mile fare. That's 10-mile radius from your home or wherever you're picking the vehicle is picking you up. And after that, each additional mile is about, after 10 miles, each additional mile is about $2 per mile extra. You can get a maximum of 4 trips per day, which is terrific for someone that might need to go to the doctor, get prescriptions at the pharmacy in the same day, maybe go to the bank, and maybe get something at the grocery store in that day. So 4 trips a day. You can bring your personal care attendant for free with the user. A personal care attendant cannot go in Abilities rides or Metro Access for that matter without the certified user. The provider in Montgomery County is Regency Taxi. Again, it is temporarily suspended. And also there is the same program that is operated by Silver Cab in Prince George's County. The number that you see on the screen was for the Regency Taxi company. And the Senior Center Shuttle, that is currently suspended. That's a terrific program that helps seniors who want to be active and attend senior centers and a few of the community centers to get there when they don't drive, and they are able to access this transportation. It is a curb-to-curb transport for county residents aged 55 and up. There are 5 county senior centers that it serves. You must live within the approved service area, which is determined by the county, which is usually within a 5-mile radius of the closest center. And then there are 3 participating community centers in this program as well. The cities of Rockville and city of Gaithersburg, they each have their own senior centers for city residents. And they also provide some limited transportation to those senior centers. And you see those phone numbers at the bottom. Ride Smart Travel Training. Sam talked about the new bus that the county will be getting for travel training. We're all very excited about that. Prior to COVID-19, JCA Connect a Ride was providing travel training to groups of seniors. And that included, it is free, and it again is part of Connect a Ride, so it is funded by Montgomery County's Department of Transportation. It was a free half-day training on how to use public transit, helping people become knowledgeable and feel comfortable using Ride-On, Metro Bus, and Metro Rail. We had a short in-classroom portion of the program, and then a much longer group excursion on a Ride-On bus. With training on the bus and about the bus, and then on Metro Rail and at a metro station. If you have questions, and you would please put them in the chat, and on anything, any topic that you've heard us talk about today, or any service, we're happy to answer your questions. And the very final slide after this will give you information about Connect-A-Ride, and also a website that you can explore your transportation options. That's a one-page publication, double-sided, that the county puts out, that has a great deal of information and contact information on what I've reviewed today. So we all thank you for participating, and we're here to answer your questions.
Yeah, I think we were talking about looking at the chat questions first, and then opening it up if there are folks who had other things they wanted to share. Before I do that, though, one of our participants, Jim Resnick, was on, and he is a fire and rescue person. And he said, Sean, please make sure to ask everyone to exercise caution when they're walking around public transportation, bus stops, etc. To please, look before crossing, wear light colored clothing, give yourself plenty of time to cross the street. Don't allow yourself to be distracted by your phones, etc. This time of year when daylight savings time goes away is a time when we have way more pedestrian incidents. Usually, we're really trying with Montgomery County's Vision Zero to put an end to all traffic fatalities, pedestrian or vehicle. But everyone has to play a part in being careful. And as folks get older, it becomes a little more difficult sometimes to judge how long it takes to get across the street. So please just play it safe and be patient. Some of the questions I just wanted to share that were on the chat. Someone did talk about Abilities Ride and feeling a bit frustrated that that isn't available to them. But I hope what folks have heard is that right now Metro Access is got almost that level of service, in that folks do not have to share a trip right now, and that their pickup windows have been much closer to the actual appointment times. Trips are shorter because they're not shared trips, and the on-time performance of Metro Access has averaged about 97% over the last 5 months. So given all these factors, Metro is encouraging folks to go ahead and use Metro Access for their transportation needs. But also keep in mind that there is that same-day access program that Sam Aji talked about. So for Montgomery County residents, you just have to prove that you're a Metro Access customer, and you pretty much can become certified to be a same-day access customer.
Yes, so all we need to see is your Metro Access card, and that automatically makes you a participant in the program. Obviously, you have to fill out a one-page application just for more information, and then we will mail your card to you, and then you begin participation. So we do encourage, at least during this time where you don't have the Abilities Ride for your same-day trips, to contact Connect-A-Ride and request information to participate in the same-day access program.
Right, I'm glad you mentioned Connect-A-Ride again, and I hope if there's nothing else people walk away with, it's that knowledge that there's this program called Connect-A-Ride, where mobility specialists they will take the time to understand your unique situation, and they'll understand where you live and where you tend to want to go, and what your abilities are or disabilities, and what your income is, and all this information that's necessary to formulate the best recommendations for your transportation options. Because we know it's overwhelming to listen to all this. I am amazed that 95 people were still on about a few minutes ago. So people really hung in there. And it's a lot of information, but you don't have to be the expert. You can always refer folks to Connect-A-Ride, and they will do their best. And if they don't know the answer to a question, they will find it out. And Lily Fisher put in the address for the YouTube channel that she runs. It's called Engage at Home, and you will find just an amazing array of videos and information about resources in Montgomery County on her Engage at Home. On that note, there are those unique situations sometimes where somebody needs an extra hand or a couple of sets of hands. And yes, some transportation providers can help with that. Sometimes it gets to a point where they can't anymore. Maybe the person has become too heavy, it can endanger. So one of the things to keep in mind is a situation might be not so much a transportation problem as a housing problem. If one cannot get in and out of one's home easily, then that may be a housing problem. And I encourage folks to call Aging and Disability Services. This is in the Department of Health and Human Services. We have a phone number that I'll put in the chat. It's 240-777-3000. So for a question that might, blend into another area outside of transportation, but housing, or maybe you need some extra help at home, help bathing or whatever. There's all kinds of things that can come up for people. And our Aging and Disability Resource Unit staff is very well educated about the resources Montgomery County can offer or our partners can offer. So please give them a call. They've been working really hard during the pandemic. 240-777-3000.
I see a question from Terry Bodnar from WOMCO about Medicaid transportation. So Terry, your question is, how soon does a client need to call for medical ride with the Medicaid transportation service? If you are a Medicaid recipient, what we do is, and especially now during the pandemic, once you call, we do a verification of your Medicaid number, ensuring that you are indeed a Medicaid recipient, verify that you're a county resident during the first call, and you can be scheduled for trips for up to a month while we wait for you to complete your application. Sean, I see something about considering household income. If you live with a family member, non-spouse, and you pay rent to the family member. So we look at each and every situation, considering, what we want to make sure that incomes don't, as long as they don't commingle, then we don't consider the household. We don't consider you as part of that household. That's the short answer to that question.
I did mention and in the chat line about military, especially military access to like Walter Reed and Bethesda, and also sometimes after a procedure, or during, they need to have somebody who is there that can be contacted, available, and to take you back.
Right, and so depending, I'm sorry about the phone in the background, depending on your eligibility, for people who need someone to be with them for the duration of their trip, that's considered escorted transportation. And that is one example of, escorted transportation is available through calling Connect a Ride. And so you can just find out if you meet the income eligibility and the disability requirements. And if not, there may be private providers or volunteer groups who can provide the service that you're talking about.
Someone is asking the acceptable purposes for use of call and ride. Call and ride is, you can use to travel to anywhere within the county for any purpose. You can use to travel to anywhere outside the county for medical reasons. So those are the ways you can use your call and ride. So it could be to play with friends, to do whatever within the county. And then if you need to go to medical appointments outside the county, you can use call and ride for that as well.
One thing I wanted to mention, this is a fine point, but we were talking about metro access being available within 3/4 of a mile of a bus stop, and that includes ride-on bus stop. So it does not just include Metro bus. So keep that in mind. You're in the Metro Access Service area if you live within 3/4 of a mile of ride-on or Metro bus.
And Terry from WOMCO also has another great question. All of these systems are great, but for our elderly and disabled residents in western part of the county, very few of these apply. Many of them have complicated application processes which require access to a computer, which for our elderly in this area is next to impossible. I would love to see some options for the western part of the county. So Terry, I'll take the second part of your question about complicated application processes. Connect a Ride is excellent as at assisting residents to complete applications for programs. So that's one I would recommend as you interact with those residents up there. If you can, I'm sure you already know about Connect a Ride. If you can encourage them to call Connect a Ride for assistance with those completing those applications or getting information. And I see Terry, you're on. Please unmute yourself and feel free to add to that if you have additional questions.
Getting to struggle out here in the western part of the county with transportation because of COVID. I mean, just fewer and fewer volunteer drivers are wanting to take clients, and clients are continuing to have multiple medical appointments. So I'm hoping that, talking to Connect a Ride, that I can at least try to get them some other services when we can't get them a ride.
Connect a Ride staff would be happy to work with your folks. You can send as many as needed. They need help. We'll do the best. If there were other times, we would maybe even make appointments and go out and meet with a group and help them one by one.
My question was about how do you calculate your income? What would I include as income when I try to put, whether or not I'm going about $40,000 per year?
So Rita, I would say if you call into Connect a Ride or call the Escorted Transportation program, the program manager can walk you through all that.
Right.
Okay, thank you.
You're welcome.
Yeah, Connect a Ride is the go-to for everything related to transportation for older adults and people with disabilities. So we hope that it's one that, from this presentation, we've stressed Connect a Ride over and over again, because we understand how important and how well informed they are. The mobility specialists have all the information in a database, can help you complete applications, just as the slide said. And we'll share the slides with everyone, so you have all the details that you need to. But when in doubt, I would say call Connect a Ride.
Thank you very much. This was a good presentation, and I'm happy that I'll get all the slides, that will be permanent information for me. I will say that I have been in touch with Connect a Ride and JCC, and I have been given some instructions. And when I first found out about you guys was back in April, I was thrilled, because my brain tells me in future I'll be needing help very much with transportation. So thank you very much.
Thank you.
Somebody made the point that they were hoping to be able to give their Metro application at the Silver Spring station. I'm sorry if that's not been an option lately, but mailing it in should be an option. And Connect a Ride staff can help direct you to where to mail the application. I want to thank everyone for participating. It's been really, really encouraging to see that people are interested in this topic. And again, if all else fails, remember Connect a Ride. And JCA staff, can you remind everyone what the phone number and email address is for Connect a Ride?
Sure, it's 301-738-3252. Again, that's 301-738-3252. 738-3252. The email is connectaride, all one word, connectaride @accessjta.org.
Again, thank you everyone for participating. We hope this was really informative for you. We know it was quite a bit, 40 plus slides. Call Connectoride to request for the slides. But thank you everyone. It was a pleasure to do this. As time goes on, if things continue to change and we see the need for another session, we will go ahead and schedule one to continue to engage and provide information to you about the options that you have to be healthy and safe while you travel during these times. Just want to close by saying thank you everyone for participating.